Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
The most dangerous health problems are the ones that stay completely silent. You feel healthy until one routine checkup says otherwise. Because conditions like high blood pressure, heart disease, diabetes, and even some cancers don't always announce themselves early. And by the time symptoms finally appear, the damage may have already been done. Today, we're going to remind you why it's so important to make time for your annual wellness exam, as well as answer your other questions here on this episode of Ask the Doc. No appointment needed. Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your health questions and our medical experts help answer them. My name is Dr. Kamaljit Kaur, and I'm a concierge primary care physician here in beautiful South Florida. Let's get right to our questions. The first one today comes to us from Patrick, and Patrick has reached out through our YouTube page to ask, "Hi, Dr. Kaur. When I go to the dermatologist, I feel a little more nervous about undressing than I do at my regular doctor's office. Is it okay to request a chaperone during the exam?" Hi, Patrick. Thank you for sending in this question and for being brave enough to speak up for yourself and what you think is best for you to make you comfortable. I can completely understand this. With your regular doctor, your primary care physician, I assume, you likely have a good, trusting relationship, and that allows you to feel more comfortable, just like we want it to be. However, since you may not see your dermatologist that often, you may not have such a relationship with him or her just based on the fact that you maybe see them once a year for not too long. So you don't have the chance to develop that relationship. Therefore, you may not be as comfortable. And I completely understand that. As physicians, we completely understand that. And you are always able to ask for a chaperone or really anything else during the visit that's going to make your visit and your conversation with your doctor more comfortable and more open. In fact, it's actually my general rule that when I have a patient in my office and I'm talking to them in the exam room and I'm examining them, if they are a person of the opposite gender, or if there's somebody where I'm going to be examining a sensitive part of the body, or something that I feel or the patient expresses is going to make them uncomfortable in any manner, I always make sure to have a chaperone present for both of our comfort levels. And don't forget, you can also bring your own chaperone. You can bring a family member or a friend that you trust to be in the room with you as well. Whoever is going to be there to kind of be your backup if you need it, your emotional or spiritual backup, that's absolutely fine. It's common, and we as physicians welcome it absolutely. Remember, you're the one in charge of your health, and even when you're at your doctor's office, this is still true. I know sometimes it seems like the doctor is the one in charge of the visit, and I like to remind my patients that I'm there to help guide your health, to help educate you about your health, but you're the one in charge. You're the one that calls it like it is and how you want it to be. So don't ever be afraid to ask for anything that's going to make your experience better. And remember, at the end of the day, when you're comfortable, you can talk more with your doctor about what's going on. Your doctor can also sense that and open up to you a little bit more as well. And that's all going to result in a collaborative relationship with the goal of optimizing your health and making you live happy and healthy and long, which is what we all want, right? I hope that helped to answer your question and bring you a little bit of reassurance that you're not feeling, what you're feeling is not unusual. All right, let's get to our next question. And this one comes to us from a YouTube viewer. And this viewer is asking us, "Hi, doctor. I'm a type 2 diabetic and have been experiencing what seems like dawn phenomenon with my blood sugar rising into the 180s in the morning. My PCP mentioned that this isn't possible in type 2 diabetes, so I wanted to get your thoughts." Hi, YouTube viewer. I'm so glad that you sent in this question. It's very important. And more so, I'm glad that you're in tune with your diabetes and your health, and you're really keeping an eye on it, and you're vigilant about what may not be normal or what may not be expected. And, Dawn phenomenon is something that we see both in type 1 and type 2 diabetes. In fact, it can actually happen in about 50% of type 2 diabetics, believe it or not. So this can happen. Why? Due to several reasons. Generally, there's hormonal changes that occur in your body towards the morning hours. So at night you're sleeping and things are happening in your body, but essentially you are resting and recovering for the next day. Your body starts to sense, usually around 4 a.m. to 8 a.m., that it's almost time for us to wake up. And in order to wake up, we need to be energized. We need to be ready and be active for the coming day. So there's a lot of mechanisms that happen in the body to help prepare for that physiologically. And some of those include a lot of hormonal changes. This is all based on your circadian rhythm. So, your sleep cycles and how deeply you're sleeping, how well you're sleeping. So that's very important as well. But to some extent, this is a natural process, and it does result in a little bit of spike in that blood glucose in everybody to some extent. During those really early morning hours, like I mentioned, between 4 a.m. and 8 p.m., your body begins to get ready to wake itself up. And in order to do this, a large part of this process is a burst of hormones like growth hormone and cortisol, and that acts as a wake up signal. So kind of like an internal alarm clock for our bodies. When this happens, this promotes your liver or tells your liver to start releasing glucose into your bloodstream, because glucose is a primary source of energy for our bodies. So your liver has that glucose stored until the body says, hey, we're ready to go. We're ready to wake up. And when that growth hormone and when the cortisol signals say, let's go, the liver says, all right, here's all the glucose you need to wake up and get energized. Now, in non-diabetic individuals, our insulin levels are usually adequate, and our insulin metabolism and balance is adequate enough to fight the glucose from getting too high in the bloodstream. So that's why it's not something that results in a high blood glucose level for everybody. And our bodies know how to balance themselves, surprisingly. Well, not surprisingly, but amazingly, I should say. Now, in individuals without diabetes, the body does not see this as a threat. There's really nothing wrong. We kind of go about with our insulin glucose balance as normal for the rest of the day. However, and as we've seen in diabetics, there is an imbalance with how your insulin is working, if it's even working to its optimal levels. Either your body's not making enough insulin, or your body is making insulin but can't use it appropriately. So usually one of those two mechanisms is what happens in diabetes. Therefore, there's nothing to counterbalance that spike of glucose that happens. And so that glucose stays high in the bloodstream. And that can be seen as what we are saying, Dawn phenomenon in a lot of diabetic individuals. If this is happening consistently to you, then I suggest alerting your doctor. And the best way to do this, even though you suspect it might be happening, the best way to do it is to provide data points. So write it down. What you're going to want to start doing is checking your blood glucose before you go to bed, after dinner and then at bedtime. And I know it's annoying. It's not going to be, probably very comfortable to do this, but we want to know what it's doing in the middle of the night. So you might need to check it in the middle of the night as well. And then, of course, check it in the morning. Now, a lot of technology advancements have taken place. So instead of us asking physically our patients to go ahead and wake up at 2 a.m. and check your blood glucose, there's also those continuous glucose monitoring systems that are available for a lot of diabetics now. So I would encourage you to talk to your doctor about that as well. So you don't have to actually wake up, and the monitor can just monitor your blood glucose levels and report that back to your doctor. Now, if you truly do have Dawn phenomenon, this is something that needs to be treated because it's not physiologically normal. Your body is going to see it as a threat, and that might result in other complications, including worsening of the diabetes and complications of the diabetes. So if you do have this, what do you do? How do you treat it? Well, like most other conditions associated with diabetes, there's several ways to do this. Medication changes might be needed. You might need to go up or down on your insulin levels. If you're on insulin medication, you might need to change your metformin dose or other medications that you're on for your diabetes. So really sitting down with your doctor, giving them those data points, and then discussing how the medications need to be adjusted, if they need to be adjusted to treat this. One of the other recommended managements for Dawn phenomenon that's happening on a consistent basis is early morning exercise. So your body learns to burn off that excess fuel and that excess glucose in a healthy manner. And then remember, I was mentioning that this is really regulated by your circadian rhythm and your sleep cycles. This is why it's so important to get good sleep, going to bed around the same time every night, waking up around the same time every morning, and making sure that you're getting at least 7 to 9 hours of a restful sleep. I know it's not always possible, but getting restful sleep is even more important than the amount of time that you sleep. So you want to make sure that that's consistent as well. I hope that helped to answer your question. And again, I'm so glad that you're being vigilant about your health. I hope it all works out and you get things figured out quickly here. All right, let's get to our next question. This one comes to us from Malika, and she is asking, Doctor, I'm due for my next physical exam, and I have a question for you. I feel like I'm in really good shape physically, but mentally and emotionally, not so much. That being said, should I bring up my mental health during the exam? Hi, Malika. Thank you so much for sending in this question. And thank you for being brave enough to be this vulnerable by even asking it. I am so proud whenever somebody says or notes that their physical health is important, but their mental and emotional health is just as important. So kudos to you for that. And absolutely, I always talk about how important mental and emotional health is. It's our entire health, not just physical health, but we need to incorporate the other aspects of health that sometimes get put on the back burner. And that's not always the best treatment or the best way to make sure that we're healthy. We now have several studies showing that revealing that you can't be truly healthy if your mental and your spiritual and your emotional health are not on par with your physical health or not as good as they should be. And honestly, a responsible primary care physician should certainly be encouraging you to address that and should even be asking you in your annual exams, in most of your visits, but definitely during your annual exam visits, how are you doing? When we ask that question, we don't mean just physically. It's funny, I'll ask that question and my patients will say, well, I'm fine. I don't have any symptoms of, aches and pains or things like that. But then I ask again, but how are you doing? Are you happy? Are you going about your daily routine without any mental health issues? Are you feeling down and depressed? Do you feel anxious? Those kind of things are very, very important. So always feel that you are in the right to make sure you're bringing up your mental health as well. And even if your PCV doesn't directly ask you, it doesn't mean that it's not important or that it shouldn't be talked about. If you have any questions or concerns about it, absolutely bring it up during your annual visit or any visit, like I mentioned. It's very important. I hope you're able to do this and have that conversation with your primary care physician and get addressed the issues that are going to make you healthy as you can be. All right, let's get right back to our questions. And this next one comes to us through allhealthtv.com. By the way, if you haven't had a chance, you should really check out our website. It's chock full of information, and it could probably help you answer some questions that you may have about your own health. Now, this question comes to us from Octavia, and Octavia is asking us, hello, doctor. The last time I went in for a physical with my primary care physician, I remember feeling a bit rushed. I didn't say anything at the time, but now I'm wondering, should I speak up about it, or is it time to consider finding someone new? Hi, Octavia. Excellent question. And I'm so glad that you sent it in because I know this is on a lot of people's minds nowadays. It's unfortunate, but this is a common theme that I see, especially with primary care patients and people who go to their primary care doctor's office for whether it's their annual exam or for a cold or just for any other kind of checkup. Unfortunately, this has become pretty commonplace in our healthcare system for a variety of reasons. I don't like to play the blame game. There's a lot of reasons why visits with doctors have shortened and we're not able to give you as much attention as we would like to, whether that's, pressure from regulations or other issues that are going on. It is what it is. But what I want my patients to know is, as I mentioned earlier, you are in charge of your healthcare. You are in charge of how your visits go. And I want you to feel empowered and feel like you're allowed to speak up and say something, especially when it's going to affect your health. Now, while we know it's commonplace to feel a little rushed or feel like you didn't have enough time with your doctor, this is not the best way to treat our patients. And we as physicians know this, but sometimes there's really no way. Our hands are tied as well. We try to do best as we can in the time that we do have with our patients. That being said, remember, you're the advocate for your health. If you feel like you're not getting the care that you need from any kind of a healthcare provider, you always have the right to seek a second opinion or to search for another primary care physician. I can tell you my own experience. I have patients coming in all the time telling me that they're shopping for a new doctor. And when I was a younger physician, I would take offense to that sometimes, but now I've learned, and the way that healthcare is nowadays, I've learned that there's absolutely nothing wrong with this. Again, you want to have a good relationship with your doctor. In order to do that, you need to feel comfortable with them. You need to feel like they're listening to you, they're addressing your concerns, no matter how big or small they are. So if you feel like you haven't found that person yet, then you're absolutely well within your rights to go and look for that person. You can talk to other physicians and see if you're more comfortable with the way that they practice. And like I said, you're your advocate for your health, even though we're there for you, absolutely, but you're always in charge and you should do what makes you comfortable. Don't ever feel like there's anything wrong with it. Obviously, always being respectful and polite to everybody. I hope you find a primary care physician that you feel comfortable with and that you feel like is going to address all of your healthcare concerns. Go ahead and start shopping if you want to. All right, let's get to that next question. And this one comes to us from Elijah. And Elijah is reaching out to us through Facebook asking, "Howdy, Dr. Kaur. I've been hearing a lot about full body scans lately. What exactly are they? And are they a better option than a regular annual physical?" This is a great question, and I'm glad you're having me address it because this is rampant nowadays. There's definitely a lot going on. There's been some amazing advancements in healthcare and health-related technology over the last decade or so. It's amazing what we can see and do now that we weren't able to do even 5 to 10 years ago, to be honest with you. But there are a few points to note about all this new technology and the pros and cons of it. So those whole body scans may certainly pick up actual disease that's obvious and certain kinds of disease. It can't pick up every kind of disease that's out there. So even though the word says whole body exam or it's advertised as whole body exam, I want you to be aware, and I'm sure when you go for these exams, they'll tell you the same thing, that it can pick up certain diseases and cancers, but not everything. It's not 100% foolproof. They can also pick up what we call incidental findings. So while they're great at picking up certain diseases, they may also pick up some things that may look abnormal, but not necessarily pathological or disease producing. For instance, as we age, there's certain age-related changes that our body undergoes. So maybe the exam will pick up something like that and show it as abnormal. Of course, if it's somebody who's 60 years old and it's comparing it to somebody who's 20, it's going to look abnormal. But we need to review it in the context of you and your health and your health history as well. And that's going to help us determine if what's being picked up is something that's actionable. Do we need to move forward with investigation and figure this out because it looks like it could be a disease or turn into a disease later on? Or is this something that is from a past acute event that's resolved? Or is this something that really means nothing? It might be a little blip somewhere, but really doesn't mean that it's a disease. So it's really important that even if you go to these centers to get whole body exams, whatever report you get, you sit down with your doctor and you go through the results, you go through what the results mean, and if they need further follow-up. Very, very important. There's also the consideration for radiation exposure. Now, while most of these exams aren't going to expose you to any major doses of radiation, it's still possible. So you do want to talk to the providers of these whole body scans to ask them what your radiation exposure, if any, is going to be and how that's going to affect your health, especially if you're on certain medications, if you have certain implantable devices in your body. And of course, if you're a young woman who is pregnant or thinking of becoming pregnant or possibly pregnant, you want to make sure that the radiation exposure risk is outlined and you're fully aware of it. Then there's also this false expectation that sometimes patients have that these exams are perfect and they're going to detect every kind of disease. And if I get a good score, that means I'm going to be healthy for the rest of my life. And while we really, really want that to be true, it's not always the case, because you must remember that even if it's small, there's a chance that these tests will miss something, and it may miss something big, or it may miss something small that's going to turn into something big later. A lot of times, people will go with these exams and they'll have a sense of reassurance, which is great. We definitely promote that, but we also want our patients to be aware that nothing is 100%. So you still need to keep up with those validated annual exams and the screenings that they recommend, such as colonoscopies, mammograms, pap smears, lung cancer screenings, prostate cancer screenings. Those are all validated assessments and screening tests that are really pinpointing at those specific diseases that we know if we catch them early enough, we can probably eradicate them altogether. If not, just manage them to a low level, and so they don't expand and get worse in the body. So you may want to do these whole body scans, but they're not the be all end all. And because of these reasons, you don't want to hang your hat on these results or these tests either. I know they seem really cool. Like I said, there's been a lot of advancements in technology and in technology that's available to everybody, to the public, because it used to be that these types of exams you needed a prescription for. A lot of times now you can just schedule an appointment at these centers, walk in and get these exams. So you want to be careful. And then, as always, talk to your doctor, especially if you're somebody who has any amount of chronic conditions, or if you're over the age of 60. You want to talk to your doctor and say, hey, doc, I'm thinking of getting this whole body scan. What are your thoughts? Compare it to other testing that I've already done that I should be doing. And most importantly, analyze it in the context of my personal health, and how is it going to be, or how the result's going to be beneficial to me. We never want our patients to have unnecessary radiation exposure, unnecessary costs related to healthcare, and obviously the emotional aspect of it, right? Your expectations and stuff. We want to help you manage that too. So while they're really cool, take it with a grain of salt, essentially. All right. Our next question comes to us from Rory on Facebook, and Rory is asking, hi, doc. I'm very happy with my doctor and I'm in good health as far as I know anyway. Should I have checkups in between annual visits, even if I don't have symptoms of anything? Is there a way to track my health? That was some really wonderful information, and it hit the nail on the head. Yes, absolutely. If you are somebody who has certain chronic conditions, then checkups in between annual exams can help you stay healthy, even more than just seeing your doctor once a year for annual exams. Now, this all depends, as I always say, on your age, your medical history, and what your risk factors are as well. So you really want to talk to your primary care physician about a plan for those in between visits as well. And as the video mentioned, you do want to know your baseline numbers. So what is your baseline blood pressure? What is your baseline cholesterol? What do your numbers look like, so that when you do go for those intermittent checkups, if there's anything abnormal, then we know how to catch it and we know what to do next to really get it back on track and to evaluate it well. As far as tracking our health, as I mentioned about the whole body scans, there's all this new technology that's come out in the recent times, and there's many ways now to track our health, whether it's smart watches that we're wearing or monitors that can be bought over the counter. Even sometimes those glucose monitors can be bought to assess our glucose levels if we're concerned about insulin resistance. And while all these are wonderful objects to help us stay on top of our health, sometimes too much information can also not be a good thing. They always say too much of something isn't always good, right? So you really want to know, if you're tracking your health, what you're tracking it for, what are the parameters that you're looking for, and what any abnormal numbers and readings are going to mean for you personally. We also don't want our patients to get bogged down with too many numbers and data points, and that can just lead to anxiety over your health, and we don't want to create that situation either. We want you to be knowledgeable about your health. We want you to be empowered about your health, be in charge of your health, know what your health is, what your baselines are, so that you know when you talk to your doctor what kind of plan should be in place for you guys to keep you healthy. All right. These were some wonderful questions. And I think that the fact that our audience is so in tune with their health and so vigilant about staying healthy and what to look for is wonderful. Please keep sending us your questions, and I'm happy to answer them. Again, my name is Dr. Kamaljit Kaur, and it's been a pleasure. Thank you.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.